Good afternoon, committee members and public. Today we have an overview of the Human Services budget jurisdiction from nonpartisan staff. We'll review the process of submitting waiver and state plan amendments, and then finally we'll discuss our legislative priorities. And so before we begin, I'd like to level set the outline and focus on the department. Are they coming up here? Oh no, the department's next, sorry. I've asked the Department of Human Services to provide us an overview of the process that states must follow to seek federal approval of programs and policy changes resulting from the laws that this committee and the other committee have enacted and then thusly enacted by the legislature. So there's three key areas I think we need to really discussion to focus on today, and that is number one, an overview of the typical process to seek federal approval and whether or not that process has recently changed. Number two, the status update of the 2025 provisions, which there were a lot we did. The status update on the 2025 provisions that we passed. And I would also assume that will lead us to some discussion about things that we did in 2024 and 2023, because there's been a lot that we have done. And then finally, we need to have an understanding of the impacts of pending or denied federal approval on our state's budget. And that means, you know, is this going to cost our committee? We have to get money, or is that money that's been underspent? And I'm sure there's quite a few on this committee that when we start talking about underspending, that means money got forecasted off the table and into the general fund. I believe this committee in 2023, we had asked about $1.825 billion that was transferred from our jurisdiction into the general fund. So that's really, I want to understand the impacts of what that federal approval or denying or the pending does regarding our forecasted and our state's budget. So I'm actually proud of the work that we did last session. Our bipartisan, bicameral budget working group set aside the politics and we committed to that collaborative problem solving. We have debated the provisions extensively, and I'm sure that we will continue to discuss the nitty-gritty details of the 2025 provisions. I really think that this committee is set to do it. We're only going to have 13 or 14 hearings, so we got work to do as we start to set our priorities. But today, it's really about understanding that long-standing agreement between states and the federal government when it comes to caring for our neighbors who access care at home or in a nursing facility. And it's imperative that we learn what the delays are, that we assess the potential budget impacts, and we ensure that our bipartisan work that our committees and communities that elected us to do is recognized by our federal partners. So with that, I believe Mr. Monahan or Kyle, you're in it? All right, so thank you so much.
Thank you, Mr. Chair and members. I'm Kyle Raymond, fiscal analyst to this committee. So today I've been asked to give an overview of the budget jurisdiction of this committee. I'll first note that for those familiar with the jurisdiction over the past couple of years, it's remained unchanged from the 2025 session, and the last time it was changed was going into the 2023 session. So to start, in the member packets, there's a document that provides an overview of both the policy and the budget jurisdiction of this committee. So this is a part of a document that our office produces for all committees, and it's produced going into the biennium. So this was from last produced in 2025. So for this committee's budget jurisdiction, I'm going to focus my kind of comments about 2/3 of the way down the page, the box that includes the budget jurisdiction. So I'll start with the agencies. There's the Department of Human Services, which is split between this committee and the Senate Health and Human Services Committee, chaired by Senator Wickland. And then I'll also mention that there are 3 other agencies now. So direct care and treatment is listed under the Department of Human Services. That was true at the time when this document was produced. It has since changed and it's now its own department. So that is under this committee's budget jurisdiction. In addition, the Council on Disability and the Ombudsman for Mental Health and Developmental Disabilities are under this committee's jurisdiction. So then going back to DHS, I'll just provide a brief overview of the kind of key differences between what is under this committee's jurisdiction and what's under Health and Human Services. I'll start by noting that the funding for the central office for DHS is under Health and Human Services. Medical assistance is split between the two committees. So this committee has jurisdiction over long-term care, and that includes both waivers and facility funding for MA. In addition, basic care for the elderly and disabled population on MA are under this committee's jurisdiction. Chemical dependency treatment is under the committee's jurisdiction, so that includes the Behavioral Health Fund. There are also substance use disorder behavioral health grants under the committee, under DHS. The alternative care program is under this committee's jurisdiction, as well as there's a number of grants. Let me grab those. That include long-term care grants, aging and adult services grants, deaf and hard of hearing grants, disability grants, and as I mentioned before, substance use disorder grants. And all of those, the ways that they're referred to are just how how the DHS budget is structured. The last two things I'll mention are first, I haven't covered any kind of funding levels. If members of the public are interested, our office on the kind of 2026 budget tracking page, which is on the Senate website, lists all of these kind of parts of the budget by committee as reflected, and the funding levels as reflected in the most recent forecast. And lastly, I'll mention in terms of this committee's jurisdiction and the other body, so the entirety of this committee's jurisdiction is within the House Human Services Committee. And that concludes my remarks, Mr. Chair, and happy to take any questions.
Thank you for that overview, Mr. Raymond, and it just helps us settle in what our actual responsibility and jurisdictions are, and if any member ever have any questions, what falls underneath that, we should talk about that. Senator Abler.
Hi, Mr. Chair, thanks, and nice to have us back in the saddle again here. So I know I'm in the city of Coon Rapids. I used to represent part of that. And there are parts that are very contiguous near Anoka that really are more Anoka than Coon Rapids. And at some point, the city could annex certain land from Coon Rapids into Anoka if they were amenable. Is there any way for to annex some of the topics back to this committee that probably more dutifully belong with us than another fine committee being, but they're so overloaded. There's so many topics on the committee, Mr. Chair. And the workload of the Health and Human Services Committee, I think, is just unreasonable. So what do you think?
Thank you, Senator Abler. As a matter of fact, you must have had a bug in my room when I was talking with Senator Aaron May Quaid, because we specifically were talking about that, and as well as when I met with Representatives Noor and Schumacher, our committee, we had Sam, all the committee administrators, and just that came up. And I mean, it really is an issue that should have been fixed, especially like you look at ICS, 95% of that responsibility is us, but the licensing stuff is on the other committee. And so it's like, but then does that give that other committee jurisdiction to do whatever? So I think, especially as we start to get into this, I don't know what to say other than I was told there was something that was going to be fixed.
Well, Mr. Chair, and this is also the committee that does more long-term care, and I was about to give Senator Wickland heart failure, which is actually part of the health committee. So anyway, didn't want to step on her there, so thank you.
The good senator from Bloomington is, okay. I think we should go, in my opinion, Senator Wickland, if there's something that touches the jurisdiction of human services, especially on the service side, right, and that falls in, I think you and I need to have conversations about, especially if we have a short time, you're going to be stacked, whether we just keep the jurisdiction here on that conversation, especially when you would only have 5 or 10% or something of that. I mean, that's just something I think you can. Does that make sense?
I think, Mr. Chair, we can certainly have a conversation about what it is you specifically, what you mean by it, and we can take a look. I have never said that if something has I think was just stated that, like we could do whatever we want in HHS, but that's not the case. I mean, if we have something that crosses over jurisdiction, we certainly have it heard in this committee and discussed, just like if there is something that you have here that we should talk about, you know, it comes to my committee, so we can have more conversations though.
No, that's fair enough. I think what the good senator from Anoka was getting at was the conversations we had 3 years ago about that cross jurisdiction and how the House settled that conversation and the Senate never did, so that's okay.
Mr. Chair, I think that the House made decisions in 2025 on how they wanted to organize, and we have a term that goes 4 years, and so I don't know. They can do their decision-making in an independent way based on their election cycle, so.
Sounds good. Thank you. Anything else, senators? Nothing? Thank you, Mr. Raymond. Mr. Monahan, did you have anything to add to that, or we're good? We're good. Let's bring the department up. You know, I used to do that, Fata. I used to say, you're the next, you know, the next contestant on The Price is Right. You know that? It's like,
No.
And that would be funny, Mr. Chair.
thank you. So, Ms. Bailey, in the opening, I had talked about the three key areas I think that this committee, and do I need to repeat those or do you have those? Good. So welcome to the committee. Ms. Bailey, if you want to let us know who you are, and then we'll let you start. And then do you want us to stop and ask questions if they pop up, or you want us to wait till the end? What's your piece?
Chair Hoffman, I think stopping and asking questions as we go, since it's a lot of information crammed into each slide, that would probably be helpful.
So I'm going to tell you, I'm going to warn you, if you mention Hutchinson or Glencoe in there, you know there's a certain guy on this table that's going to start asking a bunch of questions. I'm kidding. Thank you. So members, just let me know if you got a point that you want to make. So thank you, Ms. Bailey, and welcome.
Thank you, Chair Hoffman and members of the committee. For the record, my name is Elise Bailey. I'm the budget director at the Department of Human Services. Today, as the chair mentioned, I'm going to go over what the department has been working on since we last met last spring. I guess we met a few weeks ago, but what we've been working on throughout the interim in terms of what passed into law last session. There are some, of course, other things we've been working on, such as responding to federal changes and the final split, as Mr. Raymond mentioned, of DHS into one agency with DCYF and DCT into two, as well as program integrity actions that we've been working on. Today I'll focus, as the chair mentioned, on the implementation of the legislative changes you passed last year. I will mention, because our relationship with the federal government is multifaceted and we have many pressures at the agency along the lines of the federal relationship, I wanted to kind of mention two aspects that we're also dealing with in addition to the waiver and state plan amendments. One is the passage of H.R. 1 made in the summer, July 4th, 2025. And this made sweeping changes to the Medicaid program, the largest change since the ACA. And why this matters is because a lot of the work at the department has been planning for these changes that will impact a lot of the populations in this committee. They'll also have interactive effects with some of the changes that you passed last year. We also have pretty significant funding pressures from the federal government. CMS has indicated that they intend to withhold $515 million per quarter. This is something that the department has never experienced with the federal government, and about $1,515 million per quarter is around $2 billion per year. We've also heard from CMS that there is risk of a deferral. So withhold is a kind of withholding of future payments. A deferral is taking back of funds that have already been sent to the state. And so these are some issues we're dealing with in terms of federal funding pressures that are in addition to the delays we're seeing in the state plan and waiver amendments.
Can you define for us the deferral? It's in rules for them to be able to do the deferral. Can you define, just so we understand what deferral actually means, to what the definition of deferral is?
Sure, Chair Hoffman. My plain language understanding is that a deferral is something that CMS uses frequently. This isn't out of the ordinary for them to take a close look at claims that they've already paid, question a certain population of those claims, and then the state has to go through each claim with them and kind of prove that the claim was paid in accordance with their policies and procedures. The withhold is something that's completely different and is, as I said, something that the state, from our experience, has never experienced. And when we've talked to other state leaders, other Medicaid directors, they also haven't experienced it. We don't know, though, the scope, timing, and resolution of the deferral. So there is extreme risk here in terms of they could pull back money they've already sent the state, and we could have a long, drawn-out process without having an administrative hearing. In the meantime, our state budget is impacted substantially.
So I'm going to go to Senator Abler, then Gruenhagen on this, but and then Senator Aaron McQuaid after that. But on the deferral, did they say? I mean, there's always when we did under 99-457 Part H, Part C, there was all the states were concerned about them not getting the funding because of the holdup that was happening in Washington D.C. Now, that didn't happen, right? But there was all this chatter out there. And so is the deferral coming from an exact letter that the department got? For example, when I asked your director or whatever, assistant commissioner, Mr. Connolly, I think is Minnesota out of compliance with its state plan, right? Because when you see one Medicaid plan in a state, guess what? You see one Medicaid plan in a state. And he said yes, right? And so in this case, the deferral comes from the fact that something was not proper, right? And so did you get a letter from them, or is this just something that they're talking about? Is that a fair question?
Chair Hoffman, we have been told they're doing a detailed review of claims already paid and that we should expect something from them related to a deferral.
No, that answered it. Senator Abler, then Senator Gruenhagen.
Well, that's a big deal. So it's really, Mr. Chair, it's like a clawback, just another word for that. Okay, but it's a cooler term. And so you've not had much due process about even knowing what it is that they're worried about? Ms. Bailey?
Ms. Bailey.
Chair Abler, my understanding it is a detailed review of those 14 high-risk services, but we do not know the, as I said, the scope, magnitude, timing, resolution. When we do get a notice of deferral, my understanding is that we are able to then go through each claim and say, no, this wasn't in accordance, or yes, this was an error in payment.
All right. Mr. Chair, and I know it's not you that does this, but
Chair Abler.
some people.
Did I say that?
Yes, you did.
Oh, whoops.
That's
Well, no, it's actually you get to keep your
Slip.
high
I've been doing this too long.
No, it's fine. No, Senator Abler is a
Mr. Chair,
fault.
it's foreshadowing. Anyway, so it's, I hope that they let you know what there is before they cause it. And it's not, you have nothing to do with this, but in a similar vein, right around New Year's, some of these people, not the New Year's part, but there's some people that are in limbo trying to know what they did wrong while they don't get any payments from, not you, maybe it's you, but your department. So I think due process all along is a good idea. And I'm trying to work on that with some language to help the department not torture people that are, really innocent, good providers too. So I hope that we get our justice and how are they going to know what you did, what didn't get paid correctly? Are they going to go into all your Are they going to call NEMT providers and say, did you have a ride? Or how are they going to know what you did with all the global billions that you have to deal with? Do you have any idea?
Ms. Bailey?
Chair Hoffman, Senator Abler, I do not know, and we'll have to keep you updated as this process goes
Thank you, I
forward.
appreciate it.
Let me go back 10 years ago. I was sitting at that end of the table. We asked the same question that, you know, it was something else that was in there, and he didn't know how CMS was doing something. It's almost like deja vu over again. Glenn, to the points. Mr. Senator Gruenhagen, go ahead.
Yeah, well, thanks for coming.
Turn your mic on.
Yeah, right, okay. Yeah, thanks for your presentation. My understanding is you referred to it, 14 areas under DHS that are the federal government is concerned about and where you might have a restriction of the money. The total dollar amount is close to $9 billion, according to the information I have. So basically, my understanding, I've done a little bit of research on this, is that the federal government wants you to address the fraud, okay? Billions of dollars of fraud, and to make sure that the people actually get the dollars that are needed. You know, one of the things about the fraud is the people that really need it are getting hurt through this process because of how Minnesota has reacted on this fraud. So what specifically to me, they're going to give you the 500 million when they're assured that it's going to the people that actually need it in these 14 areas. So what is DHS doing to respond to the federal government at this point, or plan to do to allow that money to flow through?
Ms. Bailey?
Chair Hoffman, Senator Gruenhagen, we submitted a corrective action plan to them where we laid out several steps that we are undertaking. One of them is a revalidation of every single provider in all of these services. Another item is the prepayment review and assessment of all claims. I would say that 9 billion figure has never been, we have never seen data to that extent that is a number based on any sort of validity. So right now we're assessing the claims right now. We've done a prepayment review process that we've started, and we're continuing to update those analytics accordingly. We also have other items in the corrective action plan. We'd be happy to send you a copy of that.
It'd be nice on the revalidation as to that. It would be nice to see what that process looks like, because that gets to, I think, where Glenn's trying to figure out. Go ahead.
Oh, thanks for that response. Yeah, the next question, it seems like some of the fraudsters are leaving the ship. I'll give you an example. On the EMT, emergency medical transportation, according to the information I have, between 24 and 25, the amount of trips for EMT in the last quarter dropped by 1 million trips in 1 quarter. Think about that. Now, to me, that tells me there's something desperately wrong there. If you drop 1 million, and if you have other information, I'm open to hearing it, but if you drop 1 million EMT rides in 1 quarter, the rats are leaving the ship, okay? That's what it tells me. So do you see that type of reduction in other areas where the fraudsters are leaving the ship?
Chair Hoffman, Senator Gruenhagen, the Optum analysis did look at the difference between the fourth quarter of 2020, what year was that? 2025, and the third quarter of 2025. Right now, we are validating that. Sometimes there are other variables, comparing one quarter to another quarter. There's other variables, such as seasonal impacts. You know, we have 2 holidays in there. Also, providers have a year to bill, and so there's a natural billing lag in each quarter. Those are the kinds of things we're looking at the data on. What is it about the data that we're seeing is actual cost avoidance, and what aspects about the data are other variables that are unrelated to the actions that we're taking under program integrity?
Yeah, Senator Gruenhagen. And then we're going to go to Aaron.
Thank you, Mr. Chair. Yeah, so do you agree with that 1 million figure or not, in terms of reduction on the EMT for the last quarter?
Is it, yeah, Senator?
Chair Hoffman, Senator Gruenhagen, I have not had the chance to validate that number, so I
Okay.
would like to come back to the committee with that
One last
answer.
question.
Yeah.
Thank you, Mr. Chair. You know, the other thing that has been concerning me for quite some time, and I just got reinforced at one of the county commissioner meetings with the HHS department, is the computers that the counties use. In the discussion that happened at the county commissioner meeting, you have 6 different systems that don't communicate with each other in terms of recipients, and they're using DOS from the 90s. So they hire people out of college or whatever, and they don't even know how to work with DOS. So the turnover rate is exponential. Now, a few years ago, I sat in McLeod County with some social workers, and they showed me how people game the system. How when they're caught, they move to the next system. And because we don't communicate, all right, there's no way to follow this. So you know, if you just look at the facts, it seems like the system is set up to be scammed, okay? I mean, DOS in the 90s, and we haven't updated, we had an $18 billion surplus, and we couldn't address this? I mean, what is DHS doing? The frustration of the counties is at a tipping point, and that needs to be addressed immediately if you hope to get the $500 million from the federal government and actually validate that the people are getting the benefits, you know, instead of going over to Somalia or wherever, where the allegations are. So can you respond to that?
Ms. Bailey, and then I know that part of that is the MS-DOS system. I know Representative Torkelson over in the other house is taking a lead on that. I don't know if we'll see that. I think that's all going to be in her point. So, Senator Fate.
Wait, I'd like to have a response.
I know, but you'll do it later. Go ahead, Ms. Bailey.
Chair Hoffman, Senator Gruenhagen, I agree, in order to solve this problem, we need systems upgrades. And I think at the department, we are working on what those upgrades are. We would love to come back after the governor's budget is released and provide what our anticipated solutions would be. We absolutely need modernization in our systems to fully assess all the claims going through the system, being able to have machine learning and predictive analytics to be able to flag claims, to being able to see the big picture and see trends over time. That is something that our systems do not have the capacity to do right now. We did come forward with the proposal last year trying to address this, and over the interim, we've been working on, developing that even further. So would love to come back to have like a detailed discussion on what kind of solutions, because I 100% agree with your assessment there.
Just one follow-up on that, Mr. Chair.
Glenn, you're starting to get into your time. I want to start
Yeah, I
doing
know.
a time monitor on you.
Yeah, well, I represent 70,000 people. They got a lot of questions. So, Mr. Chair, anyway, why do you think this hasn't been addressed? I mean, to the layperson, and even to the social workers I talked to, it looked like it was being done deliberately not to be addressed so people could scam the system. Why do you think it hasn't been addressed? I mean, the 90s, DOS, nobody's even taught on that anymore.
Ms. Bailey.
Chair Hoffman, Senator Gruenhagen, I mean, my personal opinion is that system modernization is really expensive. It requires ongoing sustained funding. It isn't a one-time fix. It is a more challenging fix. And as you said, we have multiple systems. We have Maxis, we have MMIS, we have SSIS, we have METS. And so the solve is complex and it's extremely expensive. I also think that, as time goes on, we're all, whether it be the House, the Senate, the governor, we're focused on independent policy solutions that help families, and that's important to do. But making those tiny little investments over time, but not looking at the big picture, that's the more expensive investment, is a challenge. So I think it is up to all of us to kind of work together and think about how we could actually fund something to that regard. DHS, our funding, admin funding is 2 to 3% of our entire budget. That includes all of our staff and all of our systems. No health insurance company, no other entity would be able to sustain business on a 2 to 3% overhead margin. So I'm there with you. We would be happy to kind of work on a solution, but it takes resources and sustained resources to do it.
I'm glad you brought that up because that's something that was just kind of, oh yeah, you need this. But then the real issue is you got this MS-DOS system and you got folks, so if you do this conversion, you got to run 2 systems or multiple systems while you're trying to, what's that called, upload to this new system? Or do you just create a new system and then these old systems, you're going to end up losing some kind of service provider in the process. So I do know that there is now talk over in the other body about this. So I think, Senator, you should get on that Torkelson bill. I think that's who it is. I keep saying Paul's name maybe because I knew that's something that he wants to make sure he takes care of, because there are counties that are got green screens, and they're doing print screens through that. Senator Etke, thanks, Glenn, for bringing that stuff up.
Thank you, Mr. Chair, for letting me sneak in for a quick clarification, because I wanted to ask you when Senator Gruenhagen talked about the NEMT rides and the reduction in rides and such, and I thought you said they have up to 1 year to bill. Is that correct?
Ms. Bailey.
Chair Hoffman, Senator Utke, yes, all Medicaid providers have up to 1 year to bill. That's
Okay. Thank you, Mr. Chair. Thank you, because that seems like an excessive amount of time and delay. So if that could create some problems too. But I just wanted to confirm that it was actually a year that they had. So thank you.
Senator Aaron McQuaid.
Thank you, Mr. Chair. Ms. Bailey, I have a few questions, but one, you're talking about CMS indicated they intend to withhold $500 million per quarter in future federal funding. And was the stated reason for this the ongoing investigations that have been happening in Minnesota?
Chair Hoffman, Senator Mayquade, the stated reasons was the risk in the 14 services.
Thank you, Mr. Chair. So I guess, one of the ways that I like to solve problems in Minnesota is to connect with colleagues in other states who are experiencing similar issues. I know Texas has the highest recorded rate of Medicaid fraud, and I do have colleagues in Texas. I also know that Florida is very high. When you adjust for Medicaid enrollees, we've got Missouri and Arkansas. Are those states also having their federal funding threatened to be withheld? And should I reach out to colleagues there to figure out how they're adjusting their budgets accordingly?
Ms. Bailey.
Chair Hoffman, Senator Mayquade, not to my knowledge. My most recent knowledge was from maybe a few weeks back, and we've heard that only California and Maine have received some sort of indication. I don't know if a formal letter yet, but they've received indication that they're next on the list. But I have not heard of those other states you listed.
Senator.
Thank you, Mr. Chair. And I think it's really important for us to bring that out to light, because obviously if this administration cared about solving fraud, they wouldn't have made our top fraud prosecutors resign because they were acting so horribly. They wouldn't have pardoned literal fraudsters who committed billions of dollars of Medicaid fraud in Florida and Georgia and other places. And so I don't take them seriously, but this is a targeting of our state and the people who need government support the most, the people who are the most vulnerable, as literal retribution, which is the president's own stated words. And this is the, I guess, what you would call administrative version of what we've seen on our streets for the last 2 months. It's completely unacceptable. We have done a lot of work in Minnesota to make sure we have program integrity. Some of that is going to be modernizing our systems. I will be introducing a bill to change the Minnesota Constitution to allow us to have bonding for tech infrastructure, because if we don't consider tech part of our infrastructure, like, what are we doing here? And so there are a lot of solutions that can come forward, but this is not helping what the federal government is doing here, because they're not about real solutions. They're pardoning fraudsters and then releasing them into the country to continue doing it, and targeting Democratic states while allowing this to continue in other states, because they don't care. It's about retribution, and it just needs to be said, because that's what's happening here.
Thank you. Here's what we're going to do. This is what happens to this great committee is we end up having conversation and it'll keep going and you'll never get back to getting back to the pressures and to really what we need to get going so we can talk about our priorities. So if members, is that okay if we just let her finish her thing and then we go? We're good. And then, so line up. Thank you. It's all yours. Thank you, Ms. Bailey.
Okay, thank you, Chair Hoffman. I'll just breeze through the rest of this kind of federal piece. This slide just gives a picture of how much money we actually do get from the feds. In fiscal year 26, about $14 billion or 52% of our budget. As Senator Mayquay just mentioned, you know, preserving Medicaid is number one. And one thing I would say about that $515 million per quarter, that will hurt not just the Medicaid program, but the entire state budget. If we don't have those federal funds coming in, it will be up to the legislature to decide how to balance the budget to come to be able to withstand a cut like that. I know MMB will be in Senator Wickland's committee tomorrow, as well as the federal focus on Friday, to kind of go over what would happen if these cuts actually did happen to our state. But it will be a jurisdiction-wide issue across all of the executive branch and all of the programs that the state runs. Okay, jumping into last session. This committee had a target of about $270 million in the first biennium and $820 million in savings in the second biennium. DHS had about $285 million in the first biennium and $938 million in savings in the second. I'll go over some of the highlights that were passed and where we are in terms of getting federal approval for them. We had over 57 budget items in the spreadsheet. I just did the simple counting, but of course within those documents, we had multiple items. So we're working on a lot of stuff and I'll go over kind of the highlights. So we were asked to give just a general highlight on how the federal approval process works and the timing of it. So of course, legislation passes in May or June. And we get to work right away on drafting and preparing our waiver amendments. That isn't as simple as it sounds. As you can imagine, having over 50 items pass in a single bill, and then we have the HHS bill of another 50. We are mapping out all of the items that passed, what their effective dates are, and where they need to land in each state plan or waiver amendments. Some items need to go in multiple amendments. If they span, say, the BI waiver and the DD waiver, they're in multiple documents and multiple requests to CMS. So we're spending the time packaging those multiple items and kind of mapping out when they need to be submitted. Of course, some items that have later effective dates, we hold off on those and try to strategize in terms of what's the most immediate items that need to be put forward. We're also in this time period planning for how we would implement the items. During session, we do some of that, of course, but once it passes into law, we're game planning on what kind of systems changes we need to do, what are the requirements behind those system changes, and planning out the timeline for rolling those out. Then most things need a public notice or public comment period prior to being submitted to CMS. That is a 30-day public comment period. And this is around the time, say the fall, September or October, where we actually receive the funding that you all appropriated. There's a delay in receiving the funding. So during this time period, we're also hiring, starting the hiring process in instances where we also received FTEs. Then we submit the state plan or waiver plan amendments to CMS. And at that point, CMS has a 90-day clock to review and approve. During this time period, we're working with CMS on responding to informal questions that they have, meeting with them on those questions. And then sometimes they issue a request for additional information, or an RAI. An RAI are formal questions that they send to us, and it stops that 90-day clock. DHS has to respond to those questions, and once those responses have been sent to CMS, the clock starts again, but the 90-day clock resets. And so that kind of makes an impact on what our implementation timelines can be. During this time period, we're also doing the final systems work, prepping for when we do get final approval, and then once we get the approval, we implement the change. There's some differences across the state plan and waiver amendment processes. For example, with the state plan, we typically can go back to the effective date we're requesting if we submitted it within that quarter. So even if, say, they approve something today and we wanted an effective date of 1/1, typically we can go back to 1/1. As long as it's within the same quarter that we submitted it. With waiver plans, we can't go back in time. And so usually it's only moving forward. And so that makes an impact on when the implementation date can be. Okay, going into the specific changes you all made, the patient-driven payment model, the PDPM model, this was a change that you implemented for nursing facility rates that changed the way we index the cost-based rates to the person's level of acuity or level of need. We previously used the RUG system, and that was being phased out by the federal government. This was implemented on the target effective date of October 1st, 2025. The next one is repealing the annual alternative payment system, or APS, property rate inflation. This one is currently at CMS and pending approval, as well as the operating cap index to CPIU, or 4%, whichever is lower. That one is pending CMS review. The surcharge, so we already had a surcharge for nursing homes and an accompanying rate add-on. That was targeted to be effective January 1st. That is also under review. However, we do know that even if approved, we would expect an end date of October 1st, 2026, due to limitations passed in HR 1 on healthcare taxes. So that is one change we're anticipating going forward. You also passed changes in the nursing, related to the Nursing Home Workforce Standards Board, which resulted in a rate increase. That is pending CMS review and approval, and we're targeting an effective date of January 1st, 2026 as well. And the last two items, phasing out single bed incentives and eliminating the layaway rate add-ons, those are effective in January of next year, so aren't in a current CBA right, or SPA right now, but we are anticipating to submit it soon.
I'm going to violate my rule.
Okay.
Lead Rasmussen, the nursing home thing. It's a great question, so you want to?
Sure.
Senator Rasmussen. And then I promise I go back to just letting you keep going, so.
Doesn't matter to me.
Thank you, Mr. Chair, and thank you, Ms. Bailey. Appreciate the presentation and update today. I've heard from a lot of nursing home administrators and nursing home workers that they were disappointed that basically this didn't start right on January 1 of this year. And there's a lot of concerns, from workers that they're not going to get a raise that they were planning on, and that their paychecks are smaller than they were anticipating. And then you also have concerns from administrators about what this could mean just for their planning over the course of the year. They had kind of told workers that they're going to be getting a potential pay increase and what it could mean for patient billing. I was wondering if you could just help us understand a little bit about why that target effective date was missed, and just to help provide some context for that.
Ms. Bailey?
Chair Hoffman, Senator Rasmussen, I would say humbly that the department is working on so many things, and that we're human, and we didn't submit this one on time. We didn't submit it prior to a 90-day, mapping out. And so that is, the fault of the department to do. I would say, though, that the rate itself can go back to January 1st when it is approved, because we did submit it within the quarter. So that is one positive. It's just kind of waiting for the approval.
There was a debate on salary rate stuff. That clarifies it right there. That's a good question. So, Go ahead, Senator.
Thank you, Mr. Chair, and thank you, Ms. Bailey. I appreciate that. And in terms of, like this kind of change, understand that it was funded in a June legislature, right? A special session is when the funding actually got passed for this. But is there anything that prevents the department from starting to work on these plan amendments ahead of time? Because like this, for example, is something that the Workforce Standards Board had put out there for a while, right? It was something that we knew coming into the legislative session, this was a proposal. It was in, I believe, the governor's budget proposal, something that we kind of knew was in the mix. Is the department able to kind of get things ready so that once a bill passes, they can get that submitted and hit the date?
Ms. Bailey?
Chair Hoffman, Senator Rasmussen, there's nothing preventing us from doing the legwork in terms of writing the amendments. We can't submit it until it's obviously passed into state law. I would say realistically, we don't have the capacity at the department to do that, given all of the items that we're negotiating in the House and Senate and governor's position at end of session. We just simply don't have the people to draft all the hypotheticals. I would love to have the capacity to do that, but from a realistic perspective, that is the barrier.
So that brings up next, Jordan, is that underspent money then?
Chair Hoffman, Senator Rasmussen, because we think we can go back to 1-1, this one we don't think is a fiscal impact to the forecast. I would say the surcharge one is.
Dang it. Wow, I guess that's a deeper question after you're done, so keep going, thank you.
Okay.
Really, I'm sorry, I violated my rule, but that was such an important, that whole conversation, because I'm just thinking, you know, I'm not going to do any forecast grab.
Really?
Anybody want to help me on this one?
Yeah, you were about to say you were thinking of it, but you dropped that thought real fast.
Keep going. Thank you.
You really have changed. Okay, the next slide is related to changes you made to min choices. The first one is the ability for people receiving services who are ages 21 through 64 to attest to no changes in needs or services rather than doing a full min choices assessment. This one, the target effective date was January 1st. It is pending review and approval. If it does get approved, we expect a delayed effective date here. The one on the bottom of the table is somewhat related. It was in the same bill, similar language, which allowed a person to have a verbal attestation or to verbally attest rather than having a signature on the min choices assessment. And this one CMS denied in the EW amendment. Therefore, it's not being implemented. The reason why I kind of talk about these two together is because they were in the same section of law that you know, you guys were all trying to make the min choices assessment easier for people in terms of when there weren't changes. And we don't know on the viability of CMS approving this first one.
I'm going to violate my rule again.
Oh, was there a rule?
I guess I said we're going to let her finish because we end up having great debates and conversation, but if it's...
I'm debating no one, Mr. Chair.
Okay. Glenn, did you hear that? We're not debating. You did not.
I'm going, Senator Gruenhagen. So the attestation to no changes in needs or services for 21 to 64, did we capture savings with that? I mean, it's obviously good policy and good for people. But did we capture savings with that as well that we will not have now?
Miss Bailey.
Chair Hoffman, Senator McQuaid, my
great
brain is
question.
telling me it was like $60,000 for a systems update, so no.
Thank you.
Thank you.
All right. So the other two on this slide, one allows min choices certified assessors in hospitals via contracts with counties. CMS approved this in the EW amendment, and we are awaiting review and approval in the disability amendments. The next one is same thing, the assessor qualifications. This removed the requirement to have a bachelor's degree. This was approved in the EW amendment, and we're waiting on the disability amendments to be approved. All right, the next slide goes over some investments he made in last year's bill under the Home and Community-Based Services area. So the first one, CFSS rate changes as a result of the SEIU agreement. This one is pending CMS review and approval. This is one where we had the clock stopped and restarted at this point. And we're just kind of waiting. This is a state plan amendment, and so we're hoping to go back to January 1st. One question I got this morning that I did a similar presentation in the House. The SEIU agreement also had increases in CDCS, and that is in the disability waiver amendments, and that is also being delayed. So that part of it may have a later effective date just because we can't go back to January 1st. The next one is allowing reimbursement of CFSS in acute care hospital settings. This target effective date was January 1st. And we are currently working on designing this for the amendment package, and so this has been delayed on our end. And we'll have to update the committee when we're releasing this for public comment. The next one allows for swimming lessons as allowable uses in CDCS and CFSS. And this had to go through many layers of approval as well. Disability waivers were, it's pending review and approval, and because it's under the waivers, we're anticipating an effective date delay. Under CFSS, no amendment is required, and so we're in the process of updating our policy pages. Modifying the out-of-home respite services. This one is also pending CMS review. And the last one, adding a new budget exception for older adults eligible for EW and discharging from the hospital. CMS approved, and we've implemented it on schedule.
Well, thanks.
Jim, can we wait till the end?
Yeah, I'm sorry.
No, that's okay. I've broken the rule twice after I promised we wouldn't do it, and so, but if you want me to break it again, I can. You want to wait? You can? Okay, thank you. Keep going.
Okay.
She's almost done.
Yep. Okay, the next slide goes over the savings items you had in HCBS. The first one was the change to DWRS inflationary adjustments. This change, of course, changed the methodology that was already in law from being based on Bureau of Labor Statistics to being based on CPI. This one's pending CMS review and approval. The next one is putting a 6-hour daily cap on individualized home supports with training. Again, pending approval in that disability waiver package, and this will also have a delayed effective date. A sleep night supervision rate, this was the change that you made to night supervision, where you established a different rate for staff who are serving while they're asleep. And this one is also pending review and will be delayed. The next one limits DWRS rate exceptions. This one has an effective date of July 1st, 2026. Right now, we're preparing for that implementation, not in the current waiver plan amendments. The next one is the item related to authorization reform. This was the item that required counties to have a second level of review over the support plans and to be sent to DHS to review if the support plan exceeded the value of the person's support plan the year prior. This one also is pending review and will have a delayed effective date. Family residential services rate changes. This one is a change from a few years back, changing family residential service rate methodology from DWRS framework rate to a tiered rate schedule. And then last year, updating what the values of that tiered rate schedule would be. This is pending review and approval and would have a delayed effective date as well. That means that we're still kind of paying family residential services rates under the old methodology. I would note that life sharing was part of this package a few years back, and we're still designing that in terms of what to put in the amendment package, so that will have a longer delay. And then the last one, this isn't federal approval related, but because it was such a big item on your spreadsheet, I thought I would notate it. the LTSS Advisory Committee. This is the committee that's in charge of coming up with around $178 million in savings, submitting a report to you all next session. And if those changes are not enacted, there would be contingent reductions. We started meeting with the committee in October, and that committee continues to meet and discuss ideas. Okay, last slide. I think this slide goes over the behavioral health changes under the jurisdiction of this committee. So in your bill last year, you did rate increases for SUD, and that one got approved and implemented by January 1st, the target date. You also had changes to disaggregate or unbundle the individual and group counseling services. This right now is posted for, or will be posted for public comment in February, and we're targeting a submission in March or April with a target effective date of July. The OTP rate changes, we notated this here too as well, just because there's a delay here. It wasn't in last year's bill, but the SPA was approved, the state plan amendment was approved. The target effective date was this year, January 1st, 2026. However, we're still working on the systems to effectuate the changes here, so that one is delayed. Traditional healing, 1115 demonstration waiver. So this was I think actually in Senator Wickland's bill, but would impact probably SUD services. This would enable the MA program to pay for traditional healing as part of the MA landscape. And so we're working with tribes to design the benefit and drafting the waiver, and have a goal to post that for public comment in March and submit it in April or May with a target effective date of January 1st of next year. And then the 1115 reentry demonstration waiver, this was the waiver I think passed in the 24 session that allowed for the department to submit a waiver to CMS to pay for certain services within 90 days of a person's release from a jail or prison. We've been working on this with counties and the Department of Corrections and have a target approval date. We've submitted it to CMS, have a target approval date of June of 2026. So working through, this one's a complex project with a target effective date of January 1st, 2027. And that is it.
Thank you. I have a bunch of questions, but I'm gonna wait because I think they'll end up coming up. You know, do we have to get, the state, do we have to approve something that changes within the state plan, questions like that? But Glenn, go ahead. First, Senator Gruenhagen.
Oh,
I gotta
thank you,
be
Mr.
more
Chair.
formal here,
All right. Yeah, thanks for the testimony. And I'd like to see some savings, so appreciate that, okay? But one of the things that has really been concerning, and I got two questions actually. One is we had like over 450 employees at DHS say that for the last several years, they were flagging fraud and tried to report it to their supervisors, and instead of being accepted and rewarded or looked into, they were persecuted, according to the fraud committee in the other house. And by the way, one of the whistleblowers was on a national television program, which I happened to catch. They were being persecuted and threatened. Even their families were threatened to silence them about the fraud that they were seeing. Has that culture changed? And why do you think we're threatening employees who are first line of defense in terms of fraud, who want to bring these concerns forward? Why is that? That is very troubling to me.
Do you have a second question you want to add to that, Glenn? Or because you asked that same question 2 weeks ago too, was about the.
Yeah, but this is a different person.
You were on the Zoom land when you were asking that one. So.
And she never did respond. So I'd like to see if she would.
I don't know if that's a budget director's thing to, we're focusing on the budget here. I mean, that's, if you want to bring the commissioner in for that one, I suppose we could do that. But Ms. Bailey, you don't have to answer that question if you don't want to, because it's not in your bailiwick. But if it is in your bailiwick, feel free to do it, because you're the finance. You're the person we talk about finances. So And Glenn, we will get that question answered. This committee will get that question answered, but
Well,
I don't think she's the right one to answer
I think
that.
all of us should be concerned about that. If employees, frontline employees, who report fraud rather than being looked into, they're being threatened and persecuted.
Yeah,
And
agreed.
that was direct testimony from those whistleblowers. Now, we did pass some protections, but we want those people. They're the frontline ones.
Yeah.
And instead, the administration was persecuting and threatening them.
It's just sad to hear that, right? And
I
so-
think somebody needs to be held accountable.
Yep,
on
here's
that.
what I'm gonna do. I'm gonna get us back on focus here.
Yep.
I agree with you. Senator Utke and I actually, a couple of years ago, do you remember that, Senator Utke? We did questions from some people, and if you look at the person sitting to the left of you, 6 years ago, it took 7 layers to get to the commissioner. So that question's out there. I think that should be something, if you want me to help sign a letter to get that question answered, I think we should get that
Okay.
from this committee. Does that make it? Now let's go to your second question.
Okay, thank you. I'll do that, Mr. Chair. Thank
As
you.
long as you don't start talking about something that isn't budget related.
Well, I think this is
I'm
budget
kidding.
related because I think it's directly connected to the withholding of the 500 million per quarter. That's budget related, in my opinion, okay? Because obviously there's going to be great difficulties if that 500 million is actually withheld. So the second question is, you know, the OLA gave a report in 2019 about fraud in childcare, all right? And out of that, the DFL legislature and Governor Walz passed laws to address the fraud, okay? And in fact, I could actually read the actual statutes, but it was very good statutes. The problem is, it was ignored. They didn't follow through on the law. Why do you think we're passing laws, and this applies to us, why do you think we pass laws, get them signed into effect, and then they're ignored, and we got billions of dollars of fraud going out the door? Why is that? I mean, why would you not implement the laws that are actually passed, duly passed by the legislature and signed into law, rather than ignoring them and allowing fraud just to flow out the door?
I wish that was our jurisdiction, Glenn. It's not.
Well, that's finances.
But this is not, and that's why we had the conversation at the very beginning with Kyle. What are our, because I agree with you on that one, and we can tackle that one, but in a different committee. So are you on that committee? It'd be nice if you were, because you could ask
Otherwise,
that
let's
question.
put it in the letter that we come with.
I'm with you.
All right?
I'm with that,
I'd
Glenn.
appreciate an answer.
So we will get an answer. We'll do that. We're going to go to Senator Abler, then we're going to Senator Utke, then we're going to Senator Mohammed, and then we're going to Senator EMQ. But first, I want to ask this question. If this is related to, if the program changes that were booked in our state's budget, right, by the legislature, and there's a bunch in here that don't get materialized, you know, whether because the governor went ahead and terminated the program, or the federal government delays or denies it, right, which there's some delays in here, but I'm talking about we forecasted some money. How are those savings or costs reflected in our forecasts? And that's something I think that's important to this committee.
Yes, Chair Hoffman, good question. After you pass a bill, what we do is we take the previous forecast and we basically take all the fiscal notes that we assume in end of session and apply it to the forecast, and that's what the end of session forecast is. Then the next forecast, if we know that there are differences in implementation, we shift out, we make assumptions shifting out the effective dates. And so sometimes that means for changes that you passed that were cost items, shifting out the effective dates, of course, would be a savings to the forecast.
Correct.
And a lot of these that you passed actually were savings. That means cost to the forecast because we have fewer months that we can implement them on the front end. So that will be applied to, if it hasn't in November, it will be in February. I think after the February forecast comes out, I'd be happy to come back and detail what those are.
I'm seeing some heads shake yes at the committee. That would be helpful. So, Senator Abler.
Well, Mr. Chair, the telepathy is continuing, first annexation and then wondering about the savings, because like a bunch of these were significant savings. And so it really is irrelevant how many are included in November, but there's some of these you anticipated for the November forecast and some, you didn't, and that's not even a question. It's not going to help us learn anything, but I appreciate you being here, and I'm not sure I want your job, so you're secure from me trying to challenge you for your position. Maybe you don't want my job either. Anyway, so if I could just whine about how come we can't get PCAs now, CFSS, in hospitals yet? Come on, Mr. Chair, how long have I been working on trying to get PCAs in hospitals? I mean, anyway, so but it's coming. Actually, I was told, don't want to be Mr. Grunehagen here, but I was told when CFS comes, it's all going to be great. Finally, I didn't do the interim one for PCA, and then CFS was delayed. So when do you think it's actually going to happen? Maybe that's my question. The CFS and acute care setting.
Were you even employed at DHS when this was first brought up in this committee?
She was happily living in a cabin in the woods up by Brainerd.
Miss Bailey, do you have an answer to that?
Chair Hoffman, Senator Abler. That item is really critical to ensure continuity of care. I'm on the same page with you on that one.
Can you repeat that? What's that before?
Continuity of care.
Thank you very much. Go ahead.
So the holdup on this one is making sure that we're clearly defining, right, what the CFSS workers' roles and responsibilities and what we're paying them for in the claim differs from what the hospital and what we're paying in that claim. And our experience over the last 6 months on program integrity issues is that we need to be really cognizant before we implement new things and structure the benefit to prevent wrong billing. So that's what we're doing right now. That's the delay, to be frank, to make sure that when we do submit it to CMS, that it is fully thought through and that we have the appropriate controls and billing procedures prior to implementing it. I don't have a timeline for you. I will get back to you on that.
Well, Mr. Chair, if I wasn't going to run again, I would run again now just to see if we can't get this thing done in my time here. So I have many questions, but I'm only going to ask one more.
Well, but you know what? It bothers me that this thing is something we have been working on forever, and it makes sense.
And everybody agrees.
There's not one person that would not agree with what you just said. And so it just drives me, it's like, yeah, go ahead.
Can we blame the messenger? No? Oh. Anyway, so, and I was doing something in the back, and so just as you got to the min choices, there were some questions, so if you've already answered it, then fine. But the first min choice thing, attestation and no changes in needs or services. So has that been, so that's the thing, is that the large and two smalls that we talked about? And that's in the loop, it's in the pipeline, waiting to be approved? Is that what this means?
Ms. Bailey.
Chair Hoffman, Senator Abler, it is in the pipeline under the disability waiver amendments. We don't know if it will be approved, though. I would say the item lowest on the screen here, the fact that CMS did not approve even changing the written to verbal, we're concerned that it may not be approved. This was one where we had talked in detail with you all on, I don't know if we can do this. We don't know if any other state has a shortened assessment. And so, yes, long story short, it's in there as you drafted it in law, but we don't know the viability of it.
So I asked this question 10 years ago, because sometimes it's like when Alan Bergman, who helped set up 10 Care System and set up you met Alan Bergman. Yeah. It's about how are we talking this? How are we doing this with CMS? Are we asking permission? Or are we saying this is what we need to do because in Minnesota's plan, this is a Minnesota need, right? That's the same question that was sitting, I don't remember what room we were in, but it wasn't this one, right? And so it just boggles my mind sometimes just refresh my memory. Is somebody physically in front of a CMS program manager saying these are important to Minnesota State? Because again, when you see one Medicaid plan in a state, you've seen one Medicaid plan in a state, right? And it just, the same question I asked 10 years ago, it's like, how is that being directed to them? Is it? Is that a fair question, Elise? 'Cause,
Yeah,
I mean,
Chair Hoffman, I think what I'm hearing you say is, how are we communicating with CMS, and does it represent the idea as?
this is our plan, right?
So we, of course, send them the written documents of the waiver amendment, and that's pretty objective on this is what we intend to do and the changes we'll make, similar to how a bill would be drafted. And then typically they ask us questions about items. Sometimes it could be questions about the changes, such as this one. Sometimes it's questions about things in our waiver plan that
And
have
that's all
been
like
there
an
for 10
email back and
years.
forth, and that's not in person?
I do think we do have some phone calls or meetings with them, but a lot of times they're written
So-
questions.
I spent 13 years reviewing Title V public health grants for the federal government, HRSA health, and they were always in person. It was the state team in front saying, these are the changes we're doing, and this is what we're doing in compliance with this. And then, you know, we write up our opinions, give it to the project manager, and then that project manager makes a determination of whether or not that state gets their Title V public health funding, right? And how they leverage that. In Minnesota, it's a small amount of money, but the fact is that was always face-to-face. And I've not heard about that process with CMS. So is the question to you is, are those interactions then mostly back and forth on email, or are we actually in presence of a CMS project manager saying, this is what we're doing? And if you don't know the answer to that, that's fine, we'll get it.
Yeah, Chair Hoffman, I can get further information. My understanding is that it's a mixture of meetings, phone calls, and maybe online, and written correspondence. We do have some instances of in-person visits from CMS, but I think that's rare. That is my understanding, but I will correct the record if I'm incorrect.
Oh, you're good. Senator Abler, and then we'll go to Utke.
Well, thanks, that's my last thing. And by the way, Rasmussen could be at the bottom of this too, so, after EMQ, so. That was not my question. So it's just, I don't know. Min choice is probably one of the worst things we ever thought of. It has taken money, did I ever say that before? It's really expensive. It costs everybody a ton of money, and to only find that a person with Down syndrome still has Down syndrome, or whatever. And I just don't understand. And I mean, Dakota County, I heard, was like 7 months behind. People can't get into the programs that actually need the programs. And I presume the department is behind, we should try to fix this up to streamline it. But Mr. Chair, how can we ever make our system work if we can't do the obvious? And I just, well, I'm frustrated about this. And between all the issues of fraud and maybe having targets that are far too high because there's money that went out the back door for just reasons of, poor systems and dishonest people and all that. And then stuff like this where there's this goofy systems that are unworkable. I'm talking to the choir, and I'm not trying to demand anything of you. But I mean, what if we had, if our 8 Congress people and 2 senators would write a letter to CMS and go we're here to stand behind the programming here. Here's some really great ideas. Here's 6 things that you don't like for some reason. We like them. And that might work, Mr. Chair. I mean, it seems like that would add some gravity, bipartisan gravitas. And I would think that, Representative Morrison, and it'd be funny to see Tom Emmer in a meeting learning about this stuff, but he would sign that on our behalf because he knows it's important to his counties and all the rest. Just a thought, so maybe I'll work on that. I guess it's a comment, Mr. Chair. Thank you.
I think something like that might be helpful.
I think Chair Hoffman, Senator Abler, I think personally it's an issue around making sure that people have due process, going back to the due process.
Yeah.
And I'm speaking from.
They can opt in.
Yeah, that was an opt-in. At least, didn't we have that conversation? It was an opt-in piece or something, I remember that conversation.
Right, but just because somebody has a disability and their disability is the same the next year doesn't mean that they don't need or wouldn't find a conversation with an assessor on how their needs may have changed that year. And I think that's where CMS is coming from in terms of making sure that.
It's an 8-hour social time. I think bring coffee and.
You were the one who brought this bill. You were the one who created min choices, so you should go. You know. Senator Utke, sorry.
Thank you, Mr. Chair. Question for Ms. Bailey on, is some of the last 3 pages, 11, 12, and 13, where we went through a number of the different items, and we've got the target, effective date, et cetera. My question is, as I look at all of those that have a effective date of, at least the target or the hope date was January 1 of 2026. We now are past the middle of February, and they all have still pending and with the note that we're going to probably see delayed effective dates. As far as where the department stood on this, were these applied for on time like we normally would do to get, shoot for the effective date of January 1, or were they filed late, or is this abnormal to see this many that are, we're a month and a half, soon to be 2 months delayed and longer? Is there a reason for this, or is this what we normally see and just don't always see it in this format?
Director Bailey.
Thank you, Senator Rasmussen and Senator Utke. I would say we are, this is an unusual amount of items that are delayed. It is a mixture of us, in some instances, submitting the amendments within the 90-day window of implementation date, not prior. And the reasons in those instances are that the department has been overwhelmed with a number of things that we're working on, whether it be HR 1 planning, whether it be all of the items that passed into law in the program integrity items. There simply is not capacity to do everything on time all the time. And so I'm coming with kind of a humble, yep, some of it is our fault. Some of it is CMS though. When we looked at previous years, how long did the typical state plan take to approve? It was anywhere between 62 days and 68 days. And now we're seeing in 2025, it's 91 days. So it's a bit of both, even before, if we would have submitted, on day 89 rather than 90 days, we likely would have had it approved within the 90-day window and had it on time. Now, we're getting more questions, we're getting more RAIs, which stops the clock, than we ever had, than we typically do. So it's a bit of both.
Senator Utke.
Thank you, Mr. Chair, and thank you. And just one kind of a follow-up or addition to that is, with these delayed effective dates, and in some cases it affects wages, in some cases it affects billings that are going up and down. Do you have a plan to effectively do that? I mean, we're going to have probably some back pay on wages, but then when there's billings that would be different, and you may have to bill a facility or provider, is that gonna take place, or are we just gonna have to kind of wipe the slate clean and just start working with it whenever that approval date comes through?
Director Bailey.
Senator Rasmussen, Senator Utke, with each of the items, we do have a plan for how it would be implemented. Some of the items that we can go back to 1/1 and we're already processing claims, a lot of times we can just update reprocess the claim on the back end. In other instances, such as DWRS, that's more complicated, where we have another IT system that calculates the rates, those get authorized in MMIS, and then we pay the claim on the back end in MMIS. With that, we're, planning for system changes and working with the counties. We'll be issuing guidance on how to reprocess or how to recalculate the claims. So it really depends on the item, but we certainly are trying to have a plan for all of the items that are delayed.
Senator Utke.
Thank you, Mr. Chair. Thank you, Ms. Bailey.
Senator McQueen.
Thank you, Senator Rasmussen. I think my question is a lot similar to my colleagues, which is I'm just trying to get my head around. I'm just trying to get.
Sorry,
so you close. I was like, are they turning this off? What are the big pieces? like the $60,000, okay, like if that doesn't happen, it doesn't happen, but I was looking back at one of our spreadsheets, and like one of them is 162 million over the biennium, which would, like, if you divide it all, it was like 6.7 million per month. And it's like every month that's delayed, is that one that we can go back, or is it one that we can't go back, or it's hard to go back? I think it would be helpful to see it sorted, like in that, like, highest amount can go back, highest amount can't go back, because I'm just trying to think about, I don't think we were thinking about a major budget overhaul. And what I'm seeing in front of me, I'm like, maybe we will have to, because this was, you know, the budget we balanced last session, tough but balanced, and it was predicated on this going through. And so I think it's not even a question. I think that's just what I'm wanting to see and to know. And then also maybe the question in there is like, every place that you have pending CMS review and approval, delayed effective date expected, is that because you're expecting that it will be approved, or are there some where you're like, well, based on what was denied, this other stuff could be denied, and then we would be up the creek, so to say?
Director Bailey.
Senator Rasmussen, Senator Mayquade. Yeah, we're just expecting them to be approved, but that doesn't mean they will be. And then on your earlier comments, I can absolutely get you information. Just looking at the list here, I would say the likely biggest impact is the nursing home surcharge, because that cuts off in the tails. Like, we had estimated that we could get that revenue ongoing, and we can only get it through October 1st. So that's probably the largest impact.
Senator Mayquade.
Thank you. If I'm looking at my spreadsheet, what was that amount?
Director Bailey, do you happen to know what the number
Ballpark.
is? Or Mr. Raymond?
Mr. Raymond, do you have last year's spreadsheet?
I'll give Mr. Raymond 1 second here.
I want to say over 100 million, but.
Mr. Raymond.
104.
Mr. Chair, what was carried on the spreadsheet for fiscal year 28-29 was, let's see, without including the rates, just the surcharge itself was 118 million in the tails.
Thank you, Mr. Raymond. Senator Mayquade.
Yikes. Thank you.
Senator Gruenhagen.
Well, thank you, Mr. Chair. Yeah, this is my last question for you. I'm trying not to interrogate you, but one of the things that my constituents ask is, has anybody been fired over all this fraud? You know, whether it's 9 billion or a billion or whatever, it's a lot of money. And it didn't go to the people who actually needed it. In fact, we had testimony at the airport of tens of millions of dollars going out in suitcases, okay, to a foreign country. And there's also an allegation a certain percentage of that went to a terrorist organization. So is anybody being held accountable or terminated? You know, I'll give you one last example. If we even had 1/10 of the fraud that the state of Minnesota has in a private corporation, the CEO would be forced to resign, he'd be prosecuted and thrown in jail. Are we at least terminating some people who are frustrating the employees who are trying to tell us about fraud, that are not following through with the laws that have been duly passed by the legislature and signed into and ignored as the money just flowed out the door? Much of it could have gone to the people who actually need it versus the ones buying new cars or real estate in a foreign country or whatever is what the allegations are. We hear nobody's been held accountable. You're in that position with DHS. Has anybody been terminated or fired?
Senator Gruenhagen, I'll just, I think that's an important question. It's a question that I asked the acting commissioner when we had a hearing a couple weeks ago, and it's a question that I'm anxious to hear an answer back on. The only thing I'd say is I don't know if Ms. Bailey as budget director would be in a position to answer that, but to the Department of Human Services staff here in the room, I think that is a question that will come back up when we have the senior leadership of the department in front of this committee again.
You know, it appears that the senior leadership needs to be terminated, to tell you the truth. We need to get somebody in there who actually holds people accountable. Thank you.
Any further questions for Director Bailey? I guess one question I had, Director Bailey, is specifically on the SEIU agreement and the PCA agreement. You had mentioned that you expect that to be approved within the first quarter. Is that something that those PCA workers that were expecting a raise on January 1 but didn't get it because of this, that they would get paid retroactively? Is that what the department's thinking?
Chair Rasmussen, the rate itself will go back to 1/1 if approved, right? And I think I'd have to talk to MMB Labor, who holds the union negotiation, on whether the collective bargaining agreement allows for that, or whether adjustments would need to be made to ensure that that wages align with the rate timing. Because what's in front of CMS right now is Medicaid rates, not the collective bargaining agreement. But it's a good question, so we'll have to work through what that means for the actual wages.
You're good? Thank you so much. This kind of sets it in. We have a few minutes. Thank you, Ms. Bailey, for bearing with this wonderful committee who we just like to ask lots of questions, and it's a good thing. Legislative priorities. I think I don't know. I started to say we have 8, 10, 12, something like 13 committee hearings, I think. There's a lot on the table this year, and what our jurisdictions, that's why it was nice to have the conversation, what it is that we can get done, what do we need to do and enhance what's going on with the department, right? And then I got to tell you, we're not probably gonna like what we see coming from, budget conversations. And so, especially if we're gonna concede to what you hear, cost savings, I'm seeing that saying, maybe we need to do a forecast grab, Glenn, but that's just, anyway, the priorities are, as far looking at the House as much as we could get with Joe Schumacher and Newer. That's why I included them last week in our conversations. And we even met just to kind of talk about how they're seeing it as well. And the committee administrators are all conversing. And so what are different priorities that we should be doing in this committee that you guys have on your mind now, or if it's just you want to connect? Glenn, it's got to stay to our jurisdiction. Go ahead.
Well, I've hammered on this from last session too.
Yeah.
We have to do comparative data with surrounding states. Okay, we got 14 areas in DHS that are being investigated. Autism and, and then when we look, and I did appreciate the historical data on autism. And again, this is off the top of my head, but I think in 2017, the average child cost of autism, and we want to help autism. I don't think anybody is against helping autistic children. Yeah. I have a nephew who's on the spectrum.
Sure.
Okay, I want to help him, but I think the average cost was $7,500 or $7,000. I think it was $7,500 in 2017. In 2023, it was $45,000 per participant.
Yeah.
Come on now, I can see it going up. To go from 7,500 to 45,000 is ridiculous.
So are you gonna?
The other thing is,
well, let me just hold on, Glenn. Just hold on. So are you thinking you're bringing a bill? Then you want us to do an actual comparison on states, or is it how? Your priority? That I know you brought it up last year, but I'm looking at the fact that we're gonna have maybe 13 times to get together.
Yeah.
You know what I mean? So
that's why I don't think it's a bill. I think staff can simply do a comparison of similar programs with other states and give the cost per participant.
So let's add that
and
to our committee.
And that will help us. Now listen, when I was on the school board, I don't know if you remember that, once a year we'd have an auditor come in, and he would give us a cost comparison per pupil with districts similar to ours, okay? And guess what? Some areas we were higher on, some areas we were lower on.
Sure.
But as a layperson, it gave me a right to ask questions. Now, maybe there's a reason the cost is higher per pupil or per autistic child.
Sure.
Maybe there's a reason, but we need to find that out. Or
Okay.
maybe they're doing something that's more effective and cost effective to deal with those students.
Sure.
But when we don't have the data for comparative purposes, and we're lay people, we don't have here, 45,000 per participant. By the way, 1 out of 36, it was stated in this committee, 1 out of 16 in the Somali area. We know parents are being paid off to get their children
All right, Glenn,
labeled.
Glenn, I want
So
to
we
pull you
need
back.
to compare that.
Glenn, thank you. We're going to add that to your, it's a letter of conversation that we need to get from the department, just some clarity. I appreciate that. Jordan.
Thank you, Mr. Chair. I think while there'll be a number of policy proposals in front of this committee that are important to consider and pass this year, I also think an important role for us to focus on this year is oversight. And I think there's a few different areas that I would appreciate the opportunity to have conversations on. One is doing a deep dive within the Department of Human Services Office of Inspector General. I know we have new leadership since last time we met, and I think it would be helpful to do a deep dive into their program integrity efforts, what's going on and what could be going on. And I think it's important. I know, Mr. Chair, even though that office sits within Senator Wickland's committee,
Yep.
they are responsible for safeguarding the programs that are funded by this committee. And so
Gotcha.
I don't think we can spend too much time making sure that the programs that are getting funded through the human services budget are being protected. Another thing, especially when we get the February forecast, I think it'd be really important for us to go through these forecast changes, especially given the information we got from Budget Director Bailey today, to understand how is this all netting out. And then one other item that we'll be introducing a bill on, but is to understand more detail from this Optum report. As you saw, there's a lot of redacted information, and again, we want to make sure that we're protecting things that are true, trade secrets, but I also think it's important for us to understand the vulnerabilities and the recommendations that we have so that we can act on them during this very short session. And I know the Department of Human Services will be bringing forward some proposals from that report, but I think it's important for us to understand what the third-party vendor identified as shortcomings in our human services systems.
You raised a question last week in that, and I remember that looking at that, you wanted to go a little deeper dive on that. So thank you. It sounds like we'll have a couple of, Sam, to add that just to their hearing, notifications, those two versus, that is a priority for us to have the conversation. Do we expect something out of that as far as a bill is concerned? Don't know. I mean, but you've raised those questions twice, and so that's pretty good. EMQ.
Thank you, Mr. Chair. I think one thing that will continue to be should be a priority for this committee this session is to really make sure that if we need to, I don't think we do, I think the Constitution lays out the duties of each branch of government pretty clearly, but if we need to add to legislation, that when we pass a law and make a program, that is the law and the program until we change it or end it. And again, that's kind of how the branches of government are set up. But if we need to make that clear, we need to figure out what that language is, and then we need to, insert it into a lot of places in statute. Because for everything that happened with housing stabilization, the program still exists in law and statute. We did not change that. In fact, we added things to it for program integrity in June. And I want to be very clear that I don't think that the executive branch has the authority or the ability to end a program. And certainly, I don't want us to continue down a road where we give that authority to an executive branch. That is our job. And so I like being a legislator. I like our branch of government, and I want to keep our powers. And if we need to be clearer in law to do that, then I'm for it, but that'll be a priority for me.
So were you listening in on the conversation that the 3 CAs were having, the 2 CAs from the House, because they're split over there, and then Sam, and it actually the Shoemaker and Newer's, the Shoemaker's CA was actually, that's what they were just having a discussion on. So I think it would be beneficial for us to if that's clearly what Neuer was saying and Schumacher were saying, the exact same thing, is we're the legislature, right? And we went into and this is what bothered me, is when we had extra time to get our work done. It was kind of like when you Rule 21 me, you're like, how come you didn't get mad at me? And I said, are you kidding me? You just bought me a week to fix this bill. Do you remember that? So it's kind of, Thank you, Jordan. I appreciate that. But that gave us time to fix it. And there was the conversation that came out of it. And then it was just completely taken out. It was like the legislature. I'm with you on that. I don't think there's a person on this committee that would disagree with that. So I think that same sentiment was over in the House as well. So maybe you can connect Aaron May Quaid with I don't know who's taking the lead, whether it's Joe or Mahmoud on that one, but I think that clearly was brought up in the conversation. Going to Senator Abler then, or are you good? Or you want to get, yeah. Is it ready? Is it already done? Oh my God, it's right here. No, this is the stabilization changing. This is eliminating the program and putting a different. No, she wants to make sure that the legislature, they cannot, in general, a body outside of the legislature just goes ahead and terminates a program that we legislatively enacted, Jim. That's what she was saying.
Yeah, I'd sign that too. Once you get it drafted, we'll carry it.
But this is a good one. She needs to be on this one too. So, but no, that's a completely a whole different thing, which that conversation was going there. So no, thanks for bringing that up. Senator Wickland, anything you thinking other than you're going to be busy?
I guess I don't, Mr. Chair, have like a specific bill, but I think, the things that have been discussed as far as strengthening program integrity and, if we can have discussions about where greater accountability can happen. And I think the governor, one of the concerns I have is that, but the governor's budget proposals won't be out for another 2-3 weeks because it comes after the forecast, and then we will have very little time to do the analysis and fine-tuning of language. But I think we should be looking at what they bring forward and seeing if we can implement some of those things this year.
Senator Abler with that.
Well, Mr. Chair, I just want to, maybe they're not written yet, but I remember, if you remember what the last year's suggestion was a 2% limit on inflation for nursing homes and all the disability stuff. Can I just point out that that's a really bad idea, and if they should find a better way than to do that. So how's that? I believe the chair sent a letter to the governor and to the trifecta about the 4%. If you remember, he said 4% is fine with us, thank you. We don't want to do 2. They said, how about 3? You go like, how about 4? You can have the bill. Isn't that what the letter said, pretty much?
And with that, I believe everybody signed that letter.
The 3 chairs did.
And the conference committee members did. All conference committee members, if I remember right.
Well, we were all in agreement.
Yeah.
We were behind our chairs.
We were behind our chairs. That's what we were doing. So, yeah. Thank you for that. Thank you.
And you won that discussion, Mr. Chair, so thank you.
I don't remember. Yeah. Monday, we're going to have the ombudsman offices here. We're going to have the RPMN folks here, Disability Law Center here. We really want to talk about the impacts that this stuff has had on people. And we started a little bit last week or 2 weeks ago having that, but it's really what bothers me is that things are happening and it seems like there's no accountability. And we have people, the story that AJ Legou did of the person, an ICS, which again, that's going to be a priority for me is ICS should be CRS, should be, there's certain things that are going to be out there, right, that are there. But here was an individual that the system knew in January that they were getting a notice that they needed to vacate that property by April, right? And so the finger pointing that went on drove me absolutely, I'm laying there and in recovery, my heart rate going up, and the doc, I got a little thing on me now, Glenn. See, every time you get jacked up, Glenn, it causes my heart to bump a little bit. So I need you to, be a little more like Hutchinson and not Glencoe. And so the thing is, what bothered me is that there was no continuity of care continuity of service. There's no continuity of care conversation that this individual now is homeless. That's a heartbreaking story. And instead of somebody from a system, right? Not a policy person like us, but somebody who's actually governance, working the system, somebody needed to come forward. And not one person came forward. That's what we're about here, is we care about the individuals. And so I don't ever want to lose that, ever. So you're going to ask me a question? You said my heart rate was, you're going to try to keep my heart rate low, Glenn. It's never simple from you.
Is there, maybe this is happening, but is there any way that DHS is trying to recover some of these fraudulent funds?
No, I don't think it's Glenn, at this point, when you look at the facts behind an individual in this instance, right, that whole apartment building was actually vacating, right? The provider was going to be gone, So where was the lead agency in this, right? And then, so I'm not going to point fingers, but I'm just going to say this, and I said this quite loudly. Not one person came forward. It's kind of like years ago when a certain person in this room threw a piece of paper in front of me and showed 7 layers between the individual who knew something was happening in the western part of this. Do you remember that, Jim Abler? And it was like, all it took was one person. And in this case, where was the systems that should have been? And if we need to fix who should be in charge, then let's fix it, guys, right? Peoples. And this is why our committee exists. That's why I'm proud of everybody on this committee, and thank you for being here today. So, see you March 4th, I hope. We're adjourned. Did I say that wrong? Is it March 4th? When's the next committee hearing? I don't know.